They fired the nurse who saved a Marine's life. 11 minutes later, a Navy helicopter dropped out of the Carolina sky and shook the hospital to its bones. If you've ever watched the wrong person get punished, while the people with titles stayed safe behind policy, this story is going to hit somewhere deep. Because this isn't just about medicine. It's about what happens when real skill collides with fear ego and a system that only respects courage after it needs it. Picture the hallway lights buzzing over polished floors, a cardboard box in a nurse's hands, the taste of anger you swallow because no one in power wants the truth. Then the windows start to rattle. Stay with me because this story goes far beyond revenge. It reveals who we trust when rules fail and seconds matter. If you're watching, like the video and comment where you're watching from. The windows had already started to tremble in the memory of the building long before anyone noticed the sound. But to understand why, Clare Mercer walked out of Atlantic Memorial Medical Center carrying a cardboard box instead of a trauma chart, you have to go back to that morning, to the hour when the emergency room was still pretending it was going to have an ordinary day. By 8:27, the lie had already collapsed. Rain from the night before still clung to the curbs outside the ambulance bay. The sky over Jacksonville was pale and washed thin, the kind of coastal light that made everything look tired before noon. In the parking lot, visitors hurried in with coffee cups and folded umbrellas. Inside, the emergency department smelled like bleach, stale air conditioning, wet fabric, and the sharp copper trace that meant somebody behind a curtain was already bleeding. At the charge desk, monitors chirped in uneven rhythm. Admissions phones rang without mercy. A child coughed a deep, barking cough from room 4. A man with a fishing hook buried in his thumb complained loudly to anyone who would listen. Somewhere near triage, a resident was trying to explain a medication delay to an old woman who had decided he represented everything wrong with modern medicine. And through all of it, Clare moved without wasting a single step. She wore navy scrubs that fit like a uniform and not like leisure wear. Her dark hair was pinned back so tightly it never drifted loose, not even 12 hours into a shift. No jangling bracelets, no decorative badge reels, no glitter pens stuck in a pocket for personality. She carried trauma shears, 2 pens, a folded mini notebook with waterproof pages, and a small pen light. That was it. The younger nurses sometimes said she looked like she had been carved out of discipline itself. Clare was 41 years old, but in the strange fluorescent democracy of hospital lighting age, had less to do with skin than with stillness. And Clare was still in the way old oak is still in a storm. Not stiff, not cold, just anchored. Morning, Mercer called a respiratory therapist wheeling an oxygen tank past her. Clare glanced up from a chart and gave him a short nod. How many beds are we already down? 2 waiting on housekeeping, 1 waiting on maintenance, and 1 with a monitor that lies for sport. Then it's a bad day. It's Wednesday. That earned the smallest change in her expression, not quite a smile, but close enough to let a person know they still lived in a world where humor existed. At the far end of the desk, Emily Hart was trying and failing to hide the fact that she was overwhelmed. She was 26, bright, competent, and still new enough to believe that if she hurried faster, chaos might reward her. A patient family member had cornered her with 3 questions at once. Another nurse was asking for a room assignment. The printer was coughing out labels at the speed of a machine that hated everyone equally. Clare stepped in without announcement. Emily. Emily turned relief flashing across her face. I can handle it. I know. Answer him first room assignment, second printer never. It feeds on fear. The family member, a gray-faced man in a motorcycle jacket, pointed toward the curtained hall. My wife's been waiting 40 minutes and nobody tells us anything. Clare met his eyes. Your wife is getting an abdominal panel and a repeat pressure. If either number worries me, she goes back before the next ambulance unloads. I'm not ignoring her. I'm prioritizing everyone who could stop breathing first. The honesty landed harder than comfort would have. The man blinked, then nodded once. Thank you, he muttered. Clare shifted her attention back to Emily. You don't owe anyone a performance. You owe them clarity. Emily exhaled, shoulders lowering half an inch. That was the thing about Claire. She never sounded dramatic. She did not command attention. She removed panic from the room the way some people remove clutter from a table, one deliberate motion at a time. Not everyone liked her. The younger staff admired her from a distance, but often mistook her quiet for disapproval. Residents found her unnerving because she did not play along with the usual little games of hierarchy. She answered questions directly. She did not flatter. She did not hover outside trauma rooms hoping to be noticed by the right attending physician. She did not talk about how hard her job was, and she never once used the phrase self-care in the middle of a crisis. The administrators liked her even less. Atlantic Memorial sat in a delicate place on the map and in the local economy. It served civilians-based families, highway accidents, retirees, construction workers, military overflow, and the steady stream of rural emergencies that had nowhere else nearby to go. The hospital had learned to market itself as both efficient and compassionate, a polished regional trauma center with donor walls, patient satisfaction targets, and a legal department that breathed through its teeth whenever anyone used the word improvisation. At the center of that machinery stood Douglas Vance, Chief Operating Officer, keeper of all things measurable and all things safe on paper. Vance believed in systems. He believed in documentation, risk-scoring, clean reporting lines, and phrases like continuity of standards. He dressed like every morning was an investor call. His shoes never squeaked on the floor because men like him did not move fast enough for friction. He did not hate nurses. He loved well-behaved nurses. Polished nurses, agreeable nurses who understood that medicine in a modern institution was not just about saving lives but also about protecting liability structures. Clare Mercer was the kind of professional Douglas Vance found exhausting. Her personnel file was too good to dismiss and too unsettling to celebrate. Before joining Atlantic Memorial, she had served as a Navy independent duty corpsman attached to Marine units in places where maps turned beige and radio calls ended in static. Helmand Province, Al Anbar, forward operating stations with no walls worth trusting and no operating room within reach. She had treated blast trauma, collapsed lungs, chest wounds, arterial sprays, heat casualties, shock, hemorrhage, airway, compromise, and the odd silence that fell over a man right before he died. When she first interviewed at Atlantic Memorial 3 years earlier, one of the board members had described her background as extraordinary. Douglas Vance had called it difficult to integrate. Clare never corrected either of them. At 9:14 that morning, the radio report came in before the siren. Atlantic Memorial. Incoming from County EMS. Single vehicle, rollover near Route 17 junction outside Camp Lejeune. Male, approximately 22. Restrained driver. High-speed mechanism. Severe respiratory distress. Possible chest trauma. Estimated arrival 3 minutes. The charge nurse looked up. Bay 2. Clare was already moving. Across the department, 2 other trauma rooms were occupied. One held a woman from an interstate collision with a suspected splenic injury. The other held a construction worker whose right leg had been crushed between a forklift and a concrete barrier. Dr. Owen Blake, the attending trauma surgeon on call, had gone upstairs 10 minutes earlier after the interstate patient's pressure crashed. The surgical resident left in the department. Dr. Ryan Keller was technically capable and emotionally unfinished, which in an emergency can be worse than incompetence because it still has confidence. Clare pulled gloves on, checked suction, checked the airway cart, checked the chest tray, and glanced once at the wall clock. Emily, line set ready. Saline wide open if his pressure comes in soft. Respiratory gets first look at airway, but if he loses effort, I want intubation kit opened before anyone asks for it. Emily snapped into motion. Got it. EMS came through the bay doors hard and fast. The patient was young, broad-shouldered, and still carried the stubborn physical tension of someone whose body had learned to obey before it learned to rest. His uniform blouse had been cut open in the field. Dirt and glass flecks clung to the skin along his neck and clavicle. There was blood at the corner of his mouth, not enough to be dramatic, just enough to be worrying. His skin had the gray-blue cast no clinician ever forgot. Corporal Nate Alvarez, the paramedic, called out, 21, rollover likely 60+ miles per hour. Self-extricated, then collapsed. Severe shortness of breath left chest absent sounds, pulse 150 on scene, now drifting. Pressure 90/60 and falling. We started fluids. He's fighting us on the mask. Nate clawed weakly at the non-rebreather over his face. His eyes were wide, not with confusion, but with the pure animal terror of somebody who knows the air is there and cannot get enough of it. Claire leaned close enough for him to see only her. Nate, look at me. His gaze locked onto hers. I'm Claire. You're in the trauma bay. You don't have to talk. Blink if you can hear me. He blinked. Good. She put one gloved hand on his upper chest and the other at his neck. Distended veins. Trachea not where it ought to be. The left side of his chest was riding high and tight, not moving with the right. His pulse at the carotid was frantic, then oddly weak between beats. Claire did not need the monitor to tell her what his body was already shouting. Tension pneumo, she said. Dr. Keller moved to the bedside. Hold on, we need a chest film. We need air out of his chest, Claire replied. We need confirmation. She looked at him then, fully, and there was nothing hostile in her face. That made it worse. Doctor, his confirmation is turning blue. Keller flushed. You are not authorized to needle decompress without an order. Then order it. He hesitated. That was the whole problem. Not long. Not in a dramatic movie-length pause, just long enough. Claire had seen that kind of hesitation before, though usually under very different skies. It came from decent people who wanted certainty, when action required courage first and paperwork later. In a conference room that pause barely mattered. In a chest collapsing around a heart, it could become a death. Nate's pulse skittered under her fingers and thinned further. 14 gauge, Claire said. Emily had already opened the package. She handed it over with one shaky inhale. Keller stepped closer. Mercer, do not do this. Claire found the landmark by touch. Second intercostal space, then adjusted, trusting the anatomy under her fingers more than any textbook diagram. The room narrowed. Everything unnecessary vanished. Sound thinned. Motion slowed. Nate made a strangled effort to pull air in and failed. Claire inserted the needle. For 1/2 second, there was resistance. Then the trapped pressure gave way with a vicious hiss that sounded almost alive. Nate's chest jerked. His eyes squeezed shut. And then air moved. Not perfectly, not safely yet, but moved. Color faint and miraculous began to creep back beneath the gray. The monitor, which had been stumbling toward the disaster, steadied into something the body could work with. Emily whispered, "Oh my God." Claire secured the catheter, never once looking triumphant because professionals do not celebrate the bridge while they are still standing on it. Get respiratory back in here. Prepare chest tube set. Repeat pressure now. Dr. Keller stood frozen long enough to feel his own authority passing him by. Then he recovered by doing the only smart thing left available to him. He helped. 2 minutes later, Dr. Owen Blake came through the bay doors, still wearing the expression of a surgeon pulled from one emergency into another, without the dignity of transition. He took in the patient, the improved color, the line in the chest. Keller's face, Claire's bloodless calm. "What did you find?" Blake asked. Claire answered without flourish. Classic tension signs. Delay was killing him. Needle decompression bought time. He needs definitive chest tube and imaging once he can survive the trip. Blake's eyes went from the patient to the catheter and back again. He knew good work when he saw it. Good work is obvious to the right people. Then let's finish it, he said. The chest tube went in clean. Nate Alvarez stabilized enough to leave the edge of death and return to the far less romantic battlefield of hospital survival where pain has forms to sign and families ask questions nobody can answer with certainty. Before they wheeled him out, his hand twitched toward Claire's wrist. She leaned in. He could barely speak through the mask. Thought I was gone. Claire adjusted the blanket over his shoulder. Not today. Those were the only comforting words she gave him, and somehow they carried more weight than a speech would have. By 10:30, the trauma bay had been cleaned, reset, and swallowed back into the hungry rhythm of the department. Blood disappears fast in a modern hospital. You can watch the floor get mopped and almost believe the danger has passed. But memory does not sterilize as easily. News traveled the way it always did in hospitals, through fragments. A respiratory therapist told a nurse told imaging. A resident told another resident with the careful posture of somebody trying to frame the event in a way that protected his reputation. By 11:15, everyone in the emergency department knew that Clare Mercer had performed a physician-level intervention without a signed verbal order. By 11:30, someone upstairs knew too. At 12:10, Clare was called to administration. Emily followed her halfway down the corridor, then stopped. "Do you want me to come with you?" Clare glanced back. For what? Emily looked stricken by her own helplessness. "I don't know." Witness support. Clare almost smiled again. "You have 3 patients. Support them." The administrative wing of Atlantic Memorial lived in another climate from the ER. The air was cooler. The walls were quieter. Carpet absorbed urgency before it could spread. Framed photography showed smiling staff in impossible lighting. Donor plaques gleamed in brushed brass. Somewhere, a coffee machine hissed in a kitchenette no trauma patient would ever see. Douglas Vance's office was exactly what Clare expected, and less honest than a trauma room by several orders of magnitude. Dark wood shelves, degrees on the wall, a little model of the hospital near a stack of quarterly reports. Blinds half open over the parking lot. The whole space smelled faintly of expensive furniture polish and fear disguised as professionalism. Vance did not ask her to sit right away. That was deliberate. Clare remained standing until he did, and then she sat with the kind of posture that made the chair look temporary. At the side of the room sat a human resources representative named Linda Shaw, who had already arranged the termination packet in a neat paper stack. Linda wore the expression of a woman who had once wanted a more human career, and then learned to survive by turning her face into a hallway mirror. Vance folded his hands. "Ms. Mercer, thank you for coming." Clare said nothing. He continued, "I'll be direct. This morning, you initiated an invasive emergency procedure outside your authorized scope and without an attending physician's order. I treated a fatal chest emergency," Clare said. "You exposed the hospital to significant liability." She held his gaze. The alternative exposed a Marine to death. Vance's jaw tightened. He preferred conversations that could be managed with tone. Clare had a habit of forcing nouns where other people offered abstraction. "This institution has standards," he said. "We do not permit staff to improvise physician-level interventions simply because they believe they know best." Clare looked at the model hospital on his shelf for a long second, then back at the man behind the desk. That's an interesting way to describe recognizing a textbook tension pneumothorax. He leaned back, choosing composure. This is not a battlefield. For the first time, something colder than patience moved through her face. "No," she said quietly. "On a battlefield, people usually understand what a clock is." Linda Shaw shifted in her seat. Vance pressed on. "Dr. Keller reports that he instructed you not to proceed." He hesitated. He was assessing. He was watching a dying man become easier to document. Silence settled between them, taut and thin. Vance opened the folder in front of him, though he did not need to. The decision had already been made. That was another difference between his world and Claire's. In his world, judgment often arrived before evidence finished speaking. Atlantic Memorial cannot retain personnel who disregard protocol in ways that create institutional risk, he said. Effective immediately, your employment is terminated. Linda slid the papers across the desk. The room expected something from Clare then. Anger, perhaps. Pleading. Shock. some display that would reassure everyone present that they were still on recognizable human terrain. Instead, Claire read the first page, set it down, and asked, "Will I be allowed to finish my patient handoff?" Vance blinked. "That is your response?" "It's a question." Linda answered before he did. "Yes, briefly." Claire nodded once. "Good." Vance seemed unsettled by the lack of collapse. "You understand the seriousness of this." Claire rose, taking the packet but not looking at it again. "I understand that a Marine is alive." Then she added, almost as an afterthought, "The patients do not work for administration, Mr. Vance. I should get back to them." She left him with that, and for several seconds after the door closed, nobody in the office moved. Out in the corridor, the carpet muffled her steps. The polished windows reflected back a woman carrying a termination packet like an extra chart. No drama, no wobble, but something inside her had gone very still in the old dangerous way. By the time she returned to the ER, everyone knew. The silence hit first. Not complete silence. Hospitals never grant that. But a thinning of noise around a person, the social version of a cleared room. Staff glanced up and then away. A resident pretended to study a monitor. Someone at the desk lowered their voice in mid-sentence. Shame moved strangely through group settings. Most people feared being seen near the person who had just been judged by power. Claire did not punish them for it. Cowardice in a building like this often wore a young face and student debt. Emily looked up from a chart and immediately fought tears. "Claire." "It's all right," Claire said. "No, it isn't." Claire set the HR packet down beside the keyboard as if it were nothing more than an annoying discharge summary. "Room 6 first." Emily swallowed hard. "You're really doing handoff right now?" "Yes." Claire picked up the patient board and began. "Room 6 is post-op bowel resection. Drain output has been modest, but his pressure gets theatrical every time family enters, so do not chase every number with panic. Room 9 has unstable glucose and a wife who will swear he never misses insulin. She is wrong. Be kind anyway." Emily gave a watery laugh despite herself. Claire continued steady and exact. "Observation 3 has chest pain with a normal first workup and an abnormal face. Repeat the enzymes. Triage 4 is probably kidney stone, but scan if the pain migrates. And Trauma Bay 2, Corporal Nate Alvarez chest tube in place after tension release. Output every 15 minutes. If it spikes or the water seal stops behaving, you call Dr. Blake directly. Not the nursing supervisor, not the resident, Dr. Blake." Emily nodded. "I understand." "Say it back. Chest tube output every 15 minutes. Any spike or change in the seal, call Dr. Blake directly." "Good." Claire reached to her waistband and unhooked her trauma shears. The black coating was worn thin in places from years of use. One handle had a shallow scrape that caught the light. She placed them on the desk beside Emily's chart. Emily stared at them, as though the gesture meant more than the firing itself. "Keep those," Emily said quickly. Claire shook her head. "Not if they're attached to a building that thinks action is insubordination." Before Emily could answer, Dr. Owen Blake appeared at the end of the station. "Mercer." She turned. Blake was still in scrubs cap hanging loose at his neck after a case upstairs, fatigue sitting in the corners of his eyes. Unlike most physicians in the hospital, he did not wear confidence as theater. He had the plain, weathered authority of a man who knew exactly how often medicine loses. "I heard," he said. Claire spared him the burden of pretending not to know what he meant. "That would make you current." Blake looked at the packet on the desk, then at her. "For what it's worth, you were right. That and $6 buys airport coffee." He ignored the line, which was his way of respecting it. Keller froze. Nate would have coded. "Yes, I'll put that in writing." Claire studied him for a moment. Of all the people in the building, Blake came closest to speaking her language. Not because of rank. Because he understood consequences in flesh instead of theory. "You should," she said. "But don't do it for me. Do it for the next patient." Blake nodded once, understood. For a second, it seemed he might say more. Perhaps apologize for a system that rewarded hesitation when hesitation came wrapped in hierarchy. Perhaps ask if she planned to fight the termination. But hospitals eat time with such hunger that sentiment rarely survives the pager. His phone buzzed. He glanced down, cursed softly, and headed toward another room. Claire watched him go, then lifted the cardboard box someone had placed quietly under the desk for her belongings. It was smaller than 10 years of service ought to fit into. A coffee mug from a Navy medical conference in San Diego. A fleece pullover, a spare pen light, lip balm. Her folded trauma reference notebook with waterproof pages warped from humidity and age. That was all she took from the locker. No framed photos, no desk plant, no emotional debris. In the break room, 2 nurses fell silent when she entered. One of them, a decent woman named Paula, actually opened her mouth to speak, then closed it again under the weight of her own caution. Claire took her lunch container from the refrigerator, realized she no longer wanted it, and set it back. On her way out, she stopped by Bay 2. Nate Alvarez was awake enough now to recognize her, though medication had softened the edges of his fear. The chest tube dressing stood out white against his skin. Monitor lines traced his survival in green and amber. "You're heading out," he said hoarsely. Claire looked at the doorway, then back at him. Shift change. It was not a lie he needed corrected. He frowned slightly. "You the one who fixed me?" "No," she said. "Your body did the hard part. I just interrupted the stupid ending." That earned the ghost of a smile. Then his eyes closed again from exhaustion. Claire pulled the blanket higher over his shoulder, checked the line one last time out of habit, and left the bay. She signed the last of her access forms at security, handed over her ID badge, initialed a line acknowledging receipt of termination paperwork. Bureaucracy loved small signatures. They made institutional violence look tidy. At the front corridor, the glass doors opened on a bright, humid afternoon. The air outside carried salt from the coast and diesel from the road. Visitors moved through the lot with grocery store flowers and overnight bags, unaware that whole careers could be erased between lunch and visiting hours. Claire crossed the parking lot toward her old sedan. Her steps were measured, but her thoughts had begun to loosen and drift the way they always did after adrenaline, once the body no longer had a task to pin itself to. Anger was there, yes, but not the hot kind. It was older than heat. It was the cold disappointment of seeing the civilian world confirm what she had suspected all along, that some institutions would rather bury judgment than defend it, that some people could watch a life being saved and still ask who had signed the form. She reached her car, set the box on the hood for a moment, and closed her eyes. For the first time all day, the building was not asking anything of her. That silence should have felt like relief. Instead, somewhere deep in the practiced machinery of her body, another signal had already started to rise. Not through thought, through instinct, through the old part of her nervous system that had once learned to read danger from vibration, before sound from pressure before sight. The afternoon air over Atlantic Memorial had begun to change. At first, it was only a tremor under the metal skin of her car. Claire opened her eyes. The cardboard box on the hood shivered once the cracked coffee mug inside it ticking softly against the side. A gull, lifting off from the lamppost nearby, startled into the air. Across the parking lot, a man loading flowers into the back seat of his sedan stopped and looked up, squinting into the glare. Then the sound arrived. Not the thin, mechanical whine of a news helicopter or the dull chop of a routine transport bird. This was heavier than that. Deeper. A layered, muscular roar that rolled across the hospital grounds and struck the windows hard enough to make the glass murmur in its frame. Claire did not have to see the aircraft to recognize what kind of machine made that sound. Her body knew before her mind spoke the name. Seahawk. She turned toward the sky. Out over the road, dropping fast through the bright Carolina haze, came a navy gray helicopter with the rotors biting the afternoon to pieces. It was not on a relaxed approach. It came in steep, nose-high, then leveled with the kind of sudden control that belonged to pilots trained to land where calm people never expected aircraft to appear. Salt streaking marked the fuselage. The side door was already cracked. The bird swept over the top of Atlantic Memorial and the wash kicked loose leaves and paper cups across the lot. Inside the hospital, alarms started chirping, as if the building itself had taken a startled breath. Claire did not move. Not because she was afraid, because she was listening. A hospital transfer would have gone through dispatch. A routine military transport would have coordinated with the trauma desk. This approach said something else. Not disorder. Urgency. The real kind. The kind that burned away posture and made every unnecessary person step back. The Seahawk flared over the helipad and came down hard enough that the landing skids seemed to punch the afternoon into silence for one brief second before the full rotor thunder swallowed everything again. The main entrance doors of the hospital burst open as visitors and staff rushed toward the glass. Orderlies and scrubs, 2 environmental services workers, a woman from administration clutching a tablet, even one of the volunteers in her pale blue vest. They all turned toward the pad with the same open-faced need to witness what did not belong in a normal day. Claire reached for the box on the hood and did not lift it. The side door of the helicopter slid all the way open. 4 figures in flight gear and body armor hit the ground before the rotors had fully slowed. They moved in a compact wedge without wasting a glance on the building, the parking lot, or the curious faces at the windows. The officer in front wore captain's bars, and the kind of expression that had been sharpened by too many hours without sleep and too many decisions made around men whose lives did not belong to them alone. Claire watched them and felt an old internal alignment settle into place. These were not people arriving to ask for directions. They were coming for something specific. Across the lot, the flowers man stepped back from his car and pulled out his phone. A teenage volunteer near the entrance looked half thrilled and half terrified. Somewhere behind Claire, somebody said, "Oh my God, is that a Blackhawk?" And a second voice answered, "No, idea, but this cannot be good." The 4 military men crossed the helipad, pushed through the hospital entrance, and vanished inside. Only then did Claire pick up her box. She had taken 3 steps toward her car door when she heard boots striking pavement behind her at a run. Mercer. The voice carried even through the fading rotor noise. She turned. A young corpsman in flight gear was sprinting toward her, one hand holding his headset cord against his chest, the other pumping hard to keep balance on the loose gravel at the edge of the lot. He could not have been older than 25. Hydraulic fluid and sweat darkened his sleeves. His breathing was ragged before he reached her. He bent at the waist for one breath, then forced the words out. "Ma'am, Captain Callahan needs you inside now." Claire studied his face, his patch the shallow cut along his jaw, the salt rings dried white along his collar. "Who are you?" "Petty Officer Mason Pike. SARC, attached out of New River." "What happened?" He swallowed. "Training breach went bad off-site. 1 operator critical. We were inbound elsewhere, then command rerouted us. They pulled your name from after action and med review records. Captain said if Mercer's here, we go here." Claire's hand tightened once on the handle of the cardboard box. The sounds of the parking lot kept moving around them. A car backing out 2 rows over. Somebody shouting for security near the main doors. The fading slap of rotors. But her attention narrowed around the corpsman in front of her. What injury? Blast, overpressure fragmentation chest, compromise possible vascular involvement. He was stable enough at lift. Then pressure got weird. Breathing got worse. "We assisted ventilations, but one side is going hard and he's not tolerating anything. Captain thinks it may be one of those bad traps. One of those bad traps. Not textbook, not clean. The kind of phrase medics used when anatomy had gone ugly and standard drills became a little too blunt for what was left of the body." Claire set the box down on the asphalt. The mug inside shifted and cracked the rest of the way. Neither of them looked. How long since the blast? 42 minutes. How long since the decline? 7, maybe 8. Any loss of pulse? Not yet. Who's managing him on the aircraft? Chief medic and captain. We had a surgeon meeting us, but weather grounded them. Claire pulled a loose strand of hair back behind her ear and looked once toward the main entrance. Her reflection flashed faintly in the hospital glass beyond the crowd. A terminated civilian nurse in Navy scrubs, no badge, no standing, no official place in the machine anymore. Then the old reflex overrode every other thought. "What's his name?" Mason answered at once. "Chief Travis Knox." Claire nodded once. "Move." She started walking fast, then running, and Mason fell in beside her. As they crossed the lot, the hospital doors kept opening and shutting as staff drifted between curiosity and alarm. 2 security guards were already trying to create a lane through the front corridor, not because anyone had ordered them yet, but because decades of institutions had trained working people to recognize real urgency when it stomped through the front entrance. Inside the lobby, the air felt overcooled and charged. Bits of dust still trembled under the recessed lights. One of the framed donor portraits on the wall had slipped crooked from the vibration. At the far end of the reception area, raised voices carried from the direction of the emergency department. Claire slowed just enough to listen before rounding the corner. Douglas Vance was speaking in that careful, polished register he used when he wanted other people to understand they were being managed. "Captain, I appreciate the seriousness of your situation, but this is a civilian hospital. You cannot simply bypass intake and demand personnel. We have credentialing requirements and chain of command for a reason." The reply came low and flat. "I did not fly into your roofline to discuss your reason." Claire turned the corner. The emergency department had gone still in the way only crowded rooms can go still, where everyone is technically moving, but all attention has been pulled to a single point. Near the nurses' station stood Captain Reed Callahan in flight gear and body armor, broad-shouldered, hollow-eyed, and utterly uninterested in the existence of anyone who could not help him keep a man alive. Behind him were 2 operators and a medic with blood on one glove up to the wrist. The smell of jet fuel and sweat had followed them in and cut through the usual hospital scents like a blade. Douglas Vance stood opposite them with 2 administrative staff, hovering a step behind one holding a clipboard she seemed to regret choosing as her tool of the day. Callahan saw Claire before anyone spoke. The entire set of his shoulders shifted not with relief exactly, but with the recognition of the correct person entering the room. Mercer. Claire took in the captain's face, the stains on the medic's sleeve, the open side pouch on one operator's vest, where somebody had reached for gear fast and not cared how it went back. Then she looked at Vance. "You were looking for me." Vance turned and actually seemed offended by the fact of her reappearance, as if chaos ought to have respected his paperwork. "Miss Mercer, you are no longer authorized to be on clinical floor space." Captain Callahan did not raise his voice. He did not need to. "Be quiet." No one in the room breathed for half a second. Vance blinked. "Excuse me." Callahan stepped toward him, not aggressively, just with a focused absence of patience that made the difference irrelevant. "My patient is circling the drain on that aircraft. I asked for Clare Mercer because your staff informed me she is the clinician who performed a field release on a trapped chest injury under active fire in Helmand and kept a man alive long enough to reach surgery. You decided to fire her over protocol." His eyes flicked once to Claire, then back. That was a mistake. Douglas Vance had spent enough years in authority to mistake composure for leverage. He drew himself up perhaps for the benefit of the staff watching, perhaps because humiliation often makes weak men choose formality as a shield. "Captain, with respect, whatever this woman may have done in a military environment, she violated the scope of practice within this institution. I cannot allow an uncredentialed former employee to direct care on hospital property." One of the operators behind Callahan made a small sound that might have been a laugh if laughter had any life in it. Claire did not move. She was watching the captain, measuring how close he was to anger, and whether anger would help. Callahan nodded once, almost as if Vance had finally clarified the shape of the obstacle. "You think this is about permission," he said. He pointed back toward the entrance with one gloved hand. "Chief Knox took blast fragmentation through the upper chest less than an hour ago. He is ventilating unevenly, pressure is degrading, and the wrong decompression path could unseat the clot, keeping him from emptying out on the litter. Our receiving surgeon is weatherlocked. Your nurse is the one name tied to a comparable save in a deteriorating pressure environment. So I'm going to ask you a question exactly once." He stepped in close enough that Vance had to tilt his head up to keep eye contact. "Do you want to help me save him, or do you want to explain to command why you blocked the one person I came here for?" The silence that followed had edges. Emily stood frozen at the desk, one hand still on a keyboard she had forgotten to use. A pair of residents were openly staring now. From farther down the hall, Claire saw Dr. Owen Blake emerge from a patient room and slow reading the scene in one sweep. Douglas Vance licked his lips and glanced around at the staff, perhaps hoping to find support in their faces. He found none. Institutions feel powerful right up until someone with a harder version of reality walks through the door. This hospital has procedures, he said, weaker now, but still clinging to the script. Claire finally spoke. "Then stop reciting them and give me the patient." Vance turned to her sharply. "You do not speak to me that way." "Then don't waste my time." Blake arrived before the exchange could turn any uglier. "What do we have?" he asked, stepping between worlds the way good surgeons often do when bad administrators fail to understand gravity. Callahan shifted his attention immediately. Blake had asked a useful question. Male 34. Naval Special Warfare. Breach training mishap. Fragmentation left upper chest. Progressive respiratory failure. Concern for pressure trap and unstable clot near the subclavian tract. Blake's face tightened. He understood enough to picture the geometry. Where is he now? Aircraft. We kept him loaded because I wasn't dragging him into an argument. Blake nodded once toward the bay. "Bring him in." Vance moved to object, but Blake cut him off without ever looking at him. "Doug, not now." The room felt the shift. Not because Blake had shouted, because he had chosen a side with a single sentence. Claire was already pulling gloves from a wall box as she spoke to Mason. "What have you got in?" "Airway, adjunct assisted bagging fluids, pressure dressing at entry. No chest release because Callahan thought the track was too dangerous blind." He was right. Mason's eyes flicked to her. "You think it's vascular?" "I think it might become vascular the second somebody gets impatient." Callahan heard that and gave the smallest nod. Agreement among professionals does not need decoration. At the edge of the desk, Emily found her voice. "Claire, do you need Trauma Bay 1 cleared?" Claire did not look back. "Yes. Move chest pain to observation. Put the construction crush in Bay 3 if Ortho has looked at him. Open every thoracic kit we have. And Emily." Emily straightened. "Yes. Breathe." That nearly broke her. She swallowed and nodded hard instead. The military team turned as one toward the entrance, but Vance made one last attempt to recover control. "This is unacceptable," he said louder now because volume was all he had left. "This woman is no longer employed by Atlantic Memorial. She is not covered under our liability structure, and if she touches a patient in this facility without authorization, every consequence will be on record." No one answered him immediately. Then Callahan looked over his shoulder with a stillness colder than shouting. "Write it down," he said. "Write down that you tried to stop us while a man suffocated." Vance's mouth closed. Claire had already started for the doors with Blake beside her. As they moved, he spoke under his breath so only she could hear. "You good for this?" She kept walking. "Are you?" He almost smiled. "That bad?" "Could be. Do you know what you're looking for?" "I know what I'm afraid of." Blake accepted that answer the way clinicians accept weather. Not with comfort, with focus. Outside the lobby, the path back to the pad had become a corridor of parted bodies and held breath. Visitors clung to walls. Staff stepped aside. The rotor wash still moved across the concrete in warm gusts, carrying the bitter smell of aviation fuel and sea salt. Security stood uselessly at a distance, not because they had failed, but because they had enough sense to recognize when order meant letting the right people pass. As Claire reached the helipad, the Seahawk loomed above her matte, gray, and purposeful. its belly streaked from use rather than polished for display. The rotor blades blurred overhead. The open side door framed a chaos of straps, med bags, metal hooks, dangling lines, and one pair of boots protruding from the litter inside. Chief Travis Knox lay secured under webbing and blood-stained blankets, chest rising in a pattern that was wrong before any monitor proved it. One side lagged behind. A pressure dressing sat high on the left near the clavicle. His skin had gone beyond pale and into that waxy gray clinicians hate because it suggests the body has already begun choosing which systems to abandon first. A medic at his side squeezed a bag valve mask and measured rhythm, watching a portable monitor that did not look pleased with what it was reading. Clare climbed into the aircraft without waiting to be invited. The interior was hot and loud, and smelled of blood hydraulic fluid and the metallic tang of men who had been inside adrenaline too long. She leaned over the patient, placed her fingers along the rib line, watched the neck, the chest, the shallow pull at the sternum. Travis Knox's eyelids fluttered. He was not gone enough to stop fighting, and not awake enough to help. Chief Clare said close to his ear, "You're in Jacksonville." "I'm Clare. Don't waste air talking." His lips moved anyway. She bent lower. "Hurts," he whispered. "I know." She checked the pressure dressing without lifting it fully, then followed the likely path in her mind. Fragment in high. Pressure building deeper. Not a clean corridor. Dangerous place to be clever, an equally dangerous place to be standard. "What have his ASATs done?" she asked. The medic answered at once. "Trending down. Brief bump with assist never holds. Pressure soft. Pulse 142. We lost the left almost completely 10 minutes ago." Clare looked at Callahan. Any image at scene. He shook his head. "Nothing useful." She pressed gently along the lateral chest and watched Knox's face twist even through the haze. "Mason, get me a pen light." He handed it over. She checked the pupils, listened, rechecked the neck, then drew back half an inch and made the decision. "We move him now. Bay 1, Blake with me. Nobody decompresses until I say where." The medic at the bag glanced up. "You think standard point blows the clot? I think standard point might turn him into a fountain." The medic nodded once. "No offense taken. Useful people do not defend options they have already abandoned." Together, they unlocked the litter and slid Travis Knox down from the aircraft. The wheels hit the helipad with a jolt that made him groan despite the haze. Callahan took the front corner himself. Mason and the flight medic handled the sides. Blake moved to the head. Clare walked beside the chest, one hand lightly braced against the frame, watching every rise and fall. The doors of Atlantic Memorial opened ahead of them. Through the glass, Clare could see faces lining the corridor. Hospital staff. A couple of visitors who had not yet been shooed away. Emily, at the far end near the trauma bay, pale, but ready. Douglas Vance farther back, rigid with the dawning knowledge that the floor he believed he controlled had shifted beneath him and was not coming back. They rolled Travis Knox through the entrance. The hospital swallowed the sound of the rotors, replacing it with fluorescent hum monitor chirps, the squeal of litter wheels on polished flooring, and the first thin edge of a flat alarm beginning somewhere on the portable monitor. Clare looked up at the doors of Trauma Bay 1 as they swung open. "Keep him moving," she said, and the whole room moved with her. Trauma. Bay 1 had the bright, unforgiving cleanliness of a room built for speed and stripped of mercy. Stainless steel trays reflected the overhead lights in hard white lines. The monitor by the bed was already awake and impatient, spitting out numbers before anyone in the room had earned them. A ventilator cart stood ready near the wall. 2 packs of chest supplies had been torn open so fast their wrappers still curled on the floor. The litter crossed the threshold, and the space changed shape around it. "Transfer on 3, Blake said. Hands moved in. Sheet. Straps. Lift. Slide. The body on the litter was heavy with gear muscle and the peculiar dead weight of a man whose body had begun fighting itself. Travis Knox let out a low sound when they shifted him. Not a full groan. just enough to tell everyone in the room that some part of him was still trying to stay in it. Claire stepped to the left side of the bed and stripped away what remained of the blanket. Mason moved with her, already cutting through tape and webbing to expose the chest fully. The pressure dressing near Knox's left clavicle had gone dark at the center. Bruising spread out from beneath it in angry, deepening color. One side of the chest rose late, then stalled. The other worked harder to compensate, each breath shallow and too quick. "Pulse sauce," Claire said. Emily clipped it on. 79 and falling. Pressure. The tech at the cuff read the screen. 86/52. Heart rate 147, Emily added. Sinus-attached narrow complex. Temperature later, Claire said. He's not dying from cold first. That snapped the room into the correct order of priorities. Dr. Keller had appeared at the far side of the bay with a portable ultrasound machine and a face that seemed caught between apology and resentment. He looked at Claire, then at Blake, then at the military team in full gear, and finally at the patient in front of them. His mouth opened as though he might try to reclaim a fragment of rank. Blake spoke first. "Ryan, I need the machine up and the probe ready, no speeches." Keller swallowed. Right. He rolled the unit closer and powered it up. Claire leaned over Knox and put 2 fingers along his neck, then low along the rib line. She watched the tiny pull just above the sternum with each breath, then the hollowing at the base of the throat. His neck veins stood up hard under the harsh lighting. The left upper chest felt wrong under her palm, tight in a way healthy tissue never was, but not uniformly tight. Pressure was trapped in there, yes, but it was being shaped by something inside the cavity, diverted or partially blocked. She looked at Callahan. "Tell me exactly how it happened." Callahan had not taken his eyes off the bed since the transfer. Breach range. Faulty charge. Shield wall kicked fragments left. Knox caught one in the upper chest and another through the shoulder plate. He stayed standing for 20 seconds, then lost air. We dressed the visible entry and moved. He worsened during lift. Any blood from the mouth? Minimal. Any obvious exit? None. Claire nodded once. He is trapping pressure, but the channel's ugly. Knox's eyes fluttered again. His face had gone that strained gray-white that often came right before a body either rallied or quit. Claire bent close enough for him to hear through the noise. "Chief, stay with me." His lashes moved. She saw the effort it took to bring them open. "Can't get enough," he whispered. "I know." The words were nearly gone before they formed, and still he was trying to push them out. Marines and operators always tried to report while they were drowning. It was one of the reasons they were hard to save and harder to lose. Claire put a hand on his shoulder, not comforting, just anchoring. "Save the air. Let me work." She looked up. "Respiratory bag assist only if he drops harder. Do not push volume into that left side. I do not need more pressure in there." The therapist nodded. "Understood." Keller stepped in with the ultrasound probe. "Let me get a look." "Do it," Claire said. "Gel. Hit skin." The probe moved along the chest and supraclavicular line, but every image that flickered onto the screen was a broken argument. Air artifact, shadow, distortion, a glimpse of anatomy, and then nothing trustworthy. Knox's breathing grew worse each time Keller pressed. "Not useful," Claire said. Keller bristled. "I have not finished. You are causing pain without information." He pressed again, trying to earn an answer from the screen. The image erupted in static and blur. Claire's voice stayed level. "Doctor." This time Blake intervened. "Ryan, off." Keller froze for a heartbeat, then lifted the probe away. Knox sucked at the air again, chest hitching. The monitor gave a nasty chirp and dropped the pressure another fraction. Emily read it before anyone asked. 78/48. Mason swore quietly under his breath. Claire placed both hands on the chest, one high, one low, and closed her eyes for half a second. Not to think. To remove the visual noise. She felt the skin tension, the asymmetry, the strange resilience under the upper left ribs, and the subtle vibration in tissue that had become a chamber for pressure where pressure did not belong. There it was. Not clean, not textbook, but there. The fragment track had likely entered high and angled deeper than the dressing suggested. If she vented the standard anterior route too aggressively, she might lose the little tamponade effect holding back a vessel near the subclavian path. If she did nothing, he would spiral into obstructive collapse right in front of them. Blake watched her face, not the monitor. "You found something." "I found what I hate." "What?" "An artery that might be staying closed only because the chest is a bad place to be alive." Blake exhaled through his nose. "Can we take him to the OR and open?" "Number?" Keller looked up, almost offended. "Why, no," Claire answered without taking her hands away. "Because he will arrest on the ride or on induction. He is already borrowing time." Callahan stood at the foot of the bed with both hands braced on the rail. "Say what you need." Claire looked at him. "I need everyone in this room to stop needing certainty." No one answered. That was answer enough. The lights above the bay buzzed softly. Somewhere in the hall an ambulance radio crackled and then cut out again. A supply cart wheel squealed once and kept rolling. The whole hospital continued moving just beyond the curtains, and all of it felt obscenely normal compared to the body in the bed. Douglas Vance appeared in the doorway. He had brought 2 people with him this time, one from risk management and one security supervisor who looked deeply uncomfortable to be standing there. Vance had the brittle set of a man who had discovered he was losing control and had mistaken witnesses for reinforcement. "This needs to stop," he said. No one in the bay turned fully toward him, which only made him sound louder. Claire kept working. "Close the door if you are not useful." Vance stepped inside instead. "Ms. Mercer, you are no longer employed by this institution, and you are placing this hospital in direct exposure by directing care without legal standing." Blake did not even glance his way. "Doug, get out. This is not your call alone." Callahan turned his head slowly. That was enough to make the security supervisor take one careful step back. "You have exactly one option available to you right now," Callahan said. "Leave." Vance tried again, because some men cannot tell the difference between courage and habit. "You do not have authority over hospital personnel." Callahan's stare did not change. "You are not hospital personnel to me." The risk management woman made a tiny movement toward Vance's elbow. "Mr. Vance." He ignored her. Claire finally looked up from the patient. There was no anger in her face, and that made the words hit harder. "Mr. Vance, if you need somebody to blame, you can start with me when he is breathing. If you interrupt one more second of this room before, then I will remember it longer than you will." The door stayed open for half a breath. Then Blake said very quietly, "Doug." Something in that tone reached farther than argument. Vance looked around the room, perhaps realizing too late that every set of eyes now measured him against the body on the bed and found him absurdly small. He backed out. The risk management woman followed immediately, almost grateful. The security supervisor gave Claire a look that said sorry on behalf of a structure too large to apologize for itself, then pulled the curtain closed behind them. The room exhaled once. Emily shook her head slightly as though trying to clear it. "Do you want another pressure?" "I know, it is bad," Claire said. "Get me a large bore catheter, a 3-way stopcock clamp silk lidocaine, if he can tolerate it, and if he cannot, too bad." Emily was already moving. Keller stared. "You are not seriously about to vent him blind from the lateral space." Claire turned her head just enough to meet his eyes. "I am about to keep him from dying in front of us." "That is not in any surgical protocol," Blake answered for her. "Then today the protocol can catch up." Keller looked from Blake to Claire, and finally, after a long war with his own pride, fell silent. Mason leaned in from the left. "Captain said something about you seeing this before." Claire did not look at him. Not this exactly, but close. Close enough to know I did not enjoy it. Knox jerked weakly against the sheet as another wave of pain broke through. The monitor skated higher, then suddenly dropped. His breaths turned more erratic. The right side of the chest worked like it was trying to pull double duty for a lung that had lost the argument. Emily came back with the supplies. Claire took the catheter and stopcock, checked the connections by feel, then handed the clamp to Blake. "Come here." He moved immediately. She guided his hand to the pressure dressing zone, then slightly below and medial where skin swelling and buried danger all met. "Feel that." Blake pressed carefully, firm. Not just firm, loaded. If I give him a full release through the wrong channel, the clot holding that track may unseat. Blake looked at her. "So you want a controlled vent?" "I want a whisper, not a confession." He almost smiled despite himself, then stopped because Knox's pressure dipped again, and the screen sounded uglier. Emily read it. 72/41. Pulse 153. The respiratory therapist spoke from near the head. "His effort is tiring." Claire nodded. "I know." She looked at Knox again. His lips were beginning to shade blue at the edges. Sweat stood on his forehead in tiny beads. His eyes were half open, but unfocused now, the pupils trying to stay with the room and failing. "Chief," she said louder, "listen to me." His gaze drifted toward her. "You are in a trauma bay. Do not chase the dark. Stay with my voice." His mouth moved. She bent close enough to hear. "Team, okay?" Callahan answered from the foot before Claire could. "Team is fine. You hold." The faintest tension left Knox's brow. Even now, even here, he had wanted the report first. Claire slid her hand under his left side and palpated farther back along the fifth intercostal space near the posterior line, searching for the least catastrophic route. The skin there was warm and damp, stretched taut from internal pressure. No surface landmark was trustworthy on a body this distorted by injury and muscle. She counted ribs by touch, adjusted for the shift, then checked again. Her fingers stopped. There. Not safe. Possible. Blake saw the change in her eyes. "That the spot. That is the least bad lie his body is telling me." Mason blew out a quiet breath. Emily stood very still with the silk in one hand. Keller seemed on the verge of saying something again, then thought better of it. Claire looked to respiratory. "I need him, as still as you can get him without drowning him." The therapist adjusted the airway support and nodded. "I can give you a window." "Good, I only need one." She drew the lidocaine, then paused. Knox's pressure was too poor for niceties, but pain itself could spike movement, and movement could ruin everything. She infiltrated quickly at the site, not enough to make this kind, only enough to stop it from becoming chaos. Knox hissed through his teeth and his hand twitched. Callahan caught the wrist gently and pinned it against the sheet. "Easy, Chief." Claire set the syringe down. Knife. Emily passed it over. Keller finally broke. "This is insane." Claire did not even glance his way. "Leave if you need a cleaner memory." He did not leave. Blake's voice was lower now, tuned to the narrow channel of this one task. "Talk me through exactly what you need." Claire appreciated him for asking like that. Not trying to seize command. Not asking for permission dressed as curiosity. Just getting into position. "When I enter and tell you vent, you come off pressure for half a second. No more. I need enough escape to equalize without blowing open what is staying shut. Then you clamp down again and hold until I tell you otherwise." Blake nodded. "Half second. If you give me a full second, he may bleed out." "I heard you. If I tell you lock, even if the room is screaming." "Understood." She turned to Emily. "The minute I have return, you watch pressure and say every change out loud. No whispers." Emily swallowed. "Okay." "Say it." "I say every change out loud." "Good." To Mason, she said, "The moment this line is in, I need transport cleared to ICU and a direct path. No imaging queue. No delays in hallways. If anyone tries to stop that, bring Captain." Mason's face hardened with focus. "Yes, ma'am." Callahan did not comment on the title. Men like him knew better than to interrupt language that had found its proper shape under pressure. Claire laid the scalpel lightly against the skin and stopped. For 1 second, the room saw the cost of stillness. Sweat along her temple. The minute shift of breath in her chest. The weight of every eye, not because she wanted attention, but because bodies in crisis always pull gravity around the person making the incision. Something old moved through her, then silent and distant. Not a memory, exactly. More a fragment of sensation from another place. Dust in the back of the throat. Heat radiating off metal. A younger Marine coughing blood into his sleeve while somebody shouted for smoke cover outside a torn concrete wall. The same calculus. The same impossible middle ground between pressure and bleeding. She blinked once and the trauma bay returned. No desert, no broken wall. White lights. Stainless steel. A man named Travis Knox, whose life was narrowing fast enough to hear. Clare made a small incision. Blood welled dark and controlled. Not the arterial spray she feared. Good, or at least not catastrophic yet. She advanced carefully through tissue feeling rather than forcing, guided more by resistance and anatomy than vision. The room seemed to gather in around the movement of her hand. The monitor blared again. Knox's pressure sank another notch. 68/38, Emily, said voice too high. Talk lower, Clare said. Emily swallowed. 68/38. Better. Knox's head rolled weakly toward Clare. The muscles in his neck stood out with effort. He was losing the fight to pull air. Respiratory spoke quietly. He is about done. I know. Clare advanced the catheter assembly to the margin she had chosen, then stopped recalibrating by feel. One wrong angle from here, and she could buy him 10 more seconds by taking away the rest of the night. Blake's hand stayed steady over the pressure point. I am ready. Clare looked at him. Do not watch my face. Watch my hand. He followed her wrist with surgeon stillness. Keller stood opposite now, no longer objecting. Just witnessing. Some lessons arrive only when authority fails loudly enough. The room had gone so silent that the monitor seemed indecently loud. Even the noise from the hall had thinned. People just outside the curtain could feel the shape of the moment without seeing it. Clare pressed forward a fraction more and felt the subtle give she had been seeking. There. A pocket. A chamber. A place where trapped air had turned anatomy into a weapon. Her voice was calm enough to be mistaken for ordinary. Blake. His eyes stayed on her wrist, ready. Half-second. Yes. She adjusted the stopcock with her thumb. Emily. Pressure 64/35. Callahan. I am here. Keep him from moving. Callahan's hand settled firmer at the shoulder. Mason took the other side rail. The respiratory therapist leaned in ready to pause the slightest breath assist at Clare's word. Every person in the room now occupied a small piece of one decision. Knox let out one rough shredding inhale. Clare felt the trapped pressure push back against the line. The room stopped breathing with her. On my mark, she said. No one in the room moved. The monitor gave a raw, scraping alarm. Travis Knox's chest shuddered under her hand, then stalled again. The left side tight and stubborn, the right trying to do the work of 2 lungs and failing by inches. Clare felt the resistance in the line, felt the pressure pushing back from inside the chest like a fist braced against a locked door. Her thumb settled on the stopcock. Her shoulders lowered by a fraction. Not relaxing, aligning. Vent. Blake eased off exactly as ordered. For half a second, the room filled with the savage hiss of trapped air escaping through the line. It sounded violent, intimate wrong, the body giving up a secret under force. Lock. Blake clamped down. The hiss stopped. Nothing happened. No miraculous surge. No immediate correction. Just the same hard lights, the same strained faces, the same patient hovering at the edge of a body that had nearly run out of reasons to continue. Then one beat appeared on the monitor. Weak. Late. But there. Emily stared at the screen. We have rhythm. Clare did not look up. Pressure. 67/38. Again, Clare said. The line stayed in place under her fingers. She adjusted the angle, a hair to the posterior side, feeling for the shape of the chamber as if she were trying to read a language written inside the body by pain metal and luck. Knox gave one ragged cough that did not become a breath. Vent. Blake released. Another burst of air tore through the stopcock, shorter this time, but sharper, as if some inner seam had finally begun to open. Lock. The clamp shut. The monitor answered with 3 more beats in uneven succession. Beep, beep, beep. Not healthy, not stable, but no longer a dying man falling straight down. Emily's voice steadied with purpose. 74/42. Respiratory leaned closer to the head of the bed. I am getting better chest rise on the right. Left, still poor, but not as fixed. Claire nodded once. Good, we are not done. Knox's eyes fluttered. His mouth opened, as though he might try to drag air in on his own, and this time a little more came with it. The sound was wet and thin, but real. Claire kept the line where it was and let her fingers learn the new geometry. The pocket had shifted. Not much, enough. The room seemed to realize all at once that the impossible thing had not been a grand salvation, but something far more clinical and far more terrifying. It was going to be a sequence of exact decisions, each one small enough to fit beneath a fingertip and large enough to kill him if mishandled. Blake kept his hand in place without trembling. You want another? Yes. How many? Claire's eyes stayed on the wound and the line. Until his chest stops trying to crush his heart before I open the wrong vessel. Keller had stopped pretending to object. He stood with the ultrasound machine idling uselessly at his side, watching the handwork and the monitor answer. Some lessons flatten a man. Some narrow him into attention. This one seemed to be doing both. Callahan had not changed posture at the foot of the bed, but the muscles in his jaw had eased just enough to show that hope had been allowed back into the room under armed guard. Chief, he said low, not to Claire, not to anyone else. Stay with us. Knox's lashes twitched at the sound of his voice. Claire adjusted the stopcock again. Blake, I am here. Smaller this time. A breath, not a release. He nodded. Understood. Emily swallowed. Pressure 76/44. Vent. Blake came off pressure for a fraction so small it was more intention than movement. A tight, angry whisper of air escaped. Claire felt the chest soften under her palm, not enough for comfort, enough for possibility. Lock. The clamp shut again. Knox drew a rough breath that sounded like somebody dragging a wet tarp across gravel. It was ugly. It was glorious. Respiratory looked at the chest and then at Claire. Left side is moving. Not well, Claire said. No, but it is moving. The monitor picked up a steadier run of beats. The long, accusing tone that had sliced the room apart only moments earlier was gone, now replaced by an irregular rhythm struggling toward a sit-in order. Emily looked from the screen to Claire and back again. 82/48. Mason exhaled so suddenly it was almost a laugh, except there was no joy in it, only relief leaking through discipline. He caught himself at once and went still again. Claire finally looked up at Knox's face. The gray was still there, but it was no longer the flat wax of an extinguishing candle. A little blood had returned under the skin. Not enough to make him look safe. Enough to make him look reachable. She leaned in close. Chief, if you can hear me, blink. A beat passed. Then another. Knox blinked. Callahan shut his eyes for 1 second and opened them again. Good, Claire said. Do not be brave, just be alive. His lips moved. She bent lower. Air, he whispered. You are getting some. Feels like glass. That means you are still arguing with me. I prefer that. The corner of one eye tightened almost a wince, almost humor. Then the strain took over again. Claire kept the line secured and looked at Blake. He needs a formal chest tube lower, but not before we buy more room, and not until I know what this track is willing to forgive. Blake nodded. Tell me where. 5th intercostal, lateral, but not yet. Keller spoke quietly. The fight gone from his voice. If the fragment is sitting where you think chest tube could still disturb it. It could, Claire said. So why place one at all? Because if I leave him with only this line, the pressure will rebuild, and we will be standing right back here with less margin. Keller absorbed that, and if you place it, he gets a chance to make it upstairs. No one called that optimistic. It was not. It was mathematics under fluorescent light. Claire looked at Emily. Thoracostomy tray. Emily was already reaching for it. Her hands were still trembling, but now they trembled inside motion instead of in place. The curtain at the bay entrance shifted slightly. Somebody outside had tried to peek in and thought better of it. The hallway noise beyond remained muffled and distant. The department knew something enormous was happening in here. Departments always know, even when they cannot see the blood they can feel when gravity has changed. The trauma tray opened with the crisp, tearing sound of packaged sterility surrendering to necessity. Claire drew a breath that reached all the way into her back. "Blake, you are going to place this with me. I want your hand on the track. If I say stop, you stop." He met her eyes. "Understood." Keller looked up. "You want me to scrub in?" Claire considered for half a second. Not because she doubted his skill, because she was deciding whether his presence would add calm or need. She saw the answer in the set of his shoulders. "Yes," she said, "you suction and stay quiet." That landed harder than an insult would have. He nodded anyway. "Okay." Callahan shifted his stance at the foot of the bed. "Do you need us out?" Claire answered without looking at him. "No, I need your chief still." Mason moved to the opposite rail and braced it. The room tightened around its work. Blake gloved up fresh and stepped closer. Claire guided his hand again, this time lower, finding the space she wanted and the angle she feared. The skin there was stretched and hot, the ribs hard under swelling tissue, the body trying to become impossible beneath them. "Here," she said. "You feel that?" Blake pressed with surgeon sensitivity. "Some give. Pressure above, not just below. The upper chamber is still talking to the lower space through something narrow. A tear, or a cruel joke from anatomy." He almost smiled again. Claire did not. She was listening to the chest through her fingers. Respiratory kept the assist minimal, just enough to prevent collapse without inflating disaster. Emily called out the numbers with a new steadiness. Heart rate 136. Pressure 84/50. Saturation 83. The numbers were still terrible. Terrible can work with if it is moving in the right direction. Claire picked up the scalpel. Incision. Blake nodded, ready. The cut went in clean. Dark blood surfaced and spread. Not explosive. Good. Still no sign of the vessel giving way. Keller stepped in with suction and this time worked with admirable silence, clearing the field without unnecessary fuss. Claire widened the track with blunt dissection, feeling the tissue planes separate under force and caution. Knox tensed against the bed and a strangled sound escaped him. Callahan put a hand near his shoulder, not pinning now, just grounding. "Easy." Claire spoke to the patient while she worked. "Pain is not panic, Chief. Stay where you are." His fingers twitched once against the sheet. She felt the chest shift under her hand and stopped. Hold. Everyone froze. The monitor clicked and counted the beats like a metronome in a room that had forgotten music. Claire altered the angle by a degree and resumed. The line still hissed faintly through its narrow controlled vent, a reminder that the trapped pocket had not surrendered fully. Blake watched her hands with a surgeon's discipline, and something else now. Something close to humility. Keller's voice came low. "I can see the space." "No, you cannot," Claire said. He blinked. She did not soften it. "You can see blood and light. The space is what the body gives us if we stop pretending this is clean." He said nothing after that. At last, Claire felt the resistance ease in the place she wanted. Tube. Emily handed it over. Claire fed it in carefully, not forcing, guiding it along the path she had created. Blake kept his fingers poised, ready to respond to the slightest change. For one breathless second the tube caught. Then it slid past. A gush of air and dark fluid came through at once, less violent than the first release, but substantial enough to make Knox's chest jump and the drainage chamber tremble. Respiratory's eyes lifted. Better expansion, definitely better. Emily's voice rose with disbelief and then checked itself. Pressure 90/56. Say it again, Claire said. 90/56. Callahan let out a breath through his nose that had been living in him since the helicopter landed. Mason looked away for 1 second, stared at the wall, then back at the bed, rebuilding his face into usefulness. Blake secured the tube with one hand while Claire held position. That is buying him room. It is buying him transport, Claire said. Not survival, not yet. She checked the dressing at the upper chest again, and then placed her fingers along the clavicle. The swelling there had not worsened. That mattered. The vessel, whatever state it was in, had not been provoked into catastrophe. Pressure. Emily looked down. 93/58. Heart rate 129. Keller glanced at the monitor, then at Claire. He should never have made it to this room like that. Claire secured the lower tube with swift, practiced motions. He almost did not. Keller's throat moved. There was no defense left in him now, only the raw discomfort of a person who had watched competence outrun hierarchy and knew exactly where he had stood when the race began. Knox drew a deeper breath. It was not normal. It was not easy. But for the first time since entering the bay, both sides of the chest moved in a pattern that belonged to a living man and not to a system coming apart. Claire checked the drainage, the line, the seal. Blake mirrored her movements without needing direction, now already thinking in the same narrowed channel. Callahan finally spoke the question he had been holding back. Can he make the night? Claire did not answer quickly. Men like him deserved truth, not morale. He can make the next 10 minutes, she said. That is what I have built. If surgery and ICU do not waste it, he may see morning. Callahan accepted the sentence exactly as given. Not a promise, not despair, a measurable chance. That is enough, he said. Claire looked at him then, and something in her expression softened by 1 degree. It has to be. The curtain opened suddenly, and Vance stepped in again, followed this time by 2 board members and the same risk management woman, whose face now held the expression of someone watching a legal disaster and a personal revelation arrive at the same speed. He stopped at once when he saw the room. Not because it was bloody. Hospitals are bloody. Not because it was loud. The bay had actually grown quieter. He stopped because the center of authority in that space no longer had anything to do with titles or office doors. It sat at the left side of the bed with a former employee whose hands were still inside the aftermath of a chest trying to kill its owner. Blake looked up first, out. Vance hesitated. One of the board members, a silver-haired woman Claire vaguely recognized from an annual awards dinner, stared from the drainage chamber to the tube to Claire's face. Whatever version of this event she had been told upstairs had clearly not prepared her for the sight of it. The risk management woman was the first to speak. Mr. Vance, we should not be in here. She sounded less worried about rules than about the shame of witnessing them fail. Vance said nothing. He could not seem to find a voice that fit what he was seeing. Claire did not waste more than 1 glance on him. Close the curtain or help move him. Those are your options. One of the board members turned to Vance with a look that was not subtle. Do as she says. That more than anything seemed to reduce him. Not the captain, not Blake, not the room. Another member of his own structure choosing gravity over rank. He stepped back. The curtain closed. The room returned to the patient. Claire finished securing the lower line, then stripped off 1 bloodied glove and reached for fresh gauze. Her hand underneath was marked with pressure creases and a faint tremor just beginning at the base of the thumb, now that the worst of the knife edge had passed. She ignored it. Emily, Page Y, CU attending directly. Tell them he is coming with upper chest fragment injury. Controlled pressure vent. Lateral chest tube possible threatened subclavian tract. I want blood waiting and vascular notified. Emily was already at the phone, on it. Keller type and cross if it is not already done. Massive transfusion on standby not running unless pressure slips. Or I tell you the track opened. Keller moved, yes. Respiratory switched to transport setup but keep his volumes low. Gentle only. The therapist nodded. Ready in 30 seconds. Blake stripped his gloves and put on new ones with the smooth speed of habit. I am taking him up. Claire looked at him. I know. You coming? She glanced toward the curtain as if she could see straight through it to the administration wing beyond. I am not sure this building agrees. Blake's mouth flattened. This floor does. Before she could answer, Knox's eyes opened a little wider. Not clear yet, but more present. Claire leaned close again. Chief. He stared at her for a second, dragging recognition together through pain. You got air, he whispered. A little. He swallowed and winced. You military. Used to be. He looked past her, found Callahan, and some of the strain left his face. Captain. I am here, Callahan said. Knox blinked once slow. Thought I was gone. Callahan's voice dropped even lower. Not while she is in the room. Claire ignored that and checked the dressing again. The upper track remained contained. No fresh bloom, no catastrophic surge. The fragile bad piece inside his chest was holding. Emily came off the phone. ICU is ready. Vascular is being called. Blood will be there when we arrive. Good. The room moved into transport rhythm. Lines gathered. Drainage chamber hung properly. Oxygen transferred. Bed breaks snapped loose. Sheets were straightened not because neatness mattered, but because loose cloth catches on everything at the wrong time. As they prepared to roll, the emotional current of the bay shifted. The worst danger had not passed, but it had changed species. A few minutes earlier, everyone had been staring into a hole. Now they were carrying a difficult life away from that hole and trying not to drop it. Claire looked around once, reading the faces. Emily was pale and wet-eyed, but steadier now than when the case began. She had crossed some invisible threshold between assisting and belonging. Keller looked as though someone had quietly dismantled a machine inside him and replaced it with a more honest one. Blake was already mentally upstairs planning the next set of decisions. Mason had recovered the look of a corpsman who understood exactly how close the day had come to curdling into grief. Callahan remained composed, though relief and exhaustion had finally begun to show around the edges. Move, Claire said. They rolled out into the hallway. The sight of the bed coming through with military operators, a trauma surgeon respiratory, and the woman administration had fired less than an hour earlier, created a visible wave through the department. Conversations died. Heads turned. The waiting room television kept talking to itself in the distance, absurdly cheerful, while staff in the corridor flattened against the walls to make space. Claire walked beside the chest, one hand on the rail eyes, never leaving the lines and dressings. Near the nurses' station, she saw the board members standing with Vance. They stepped aside at once. Not ceremonially, instinctively. Even the volunteers in their pale blue vests understood enough to clear the route. Vance stared at the moving bed, then at Claire. For the first time all day, he looked like a man who had glimpsed the true scale of his own mistake and found it larger than language. Claire did not slow for him. At the elevator bank, the doors opened as if timed to obedience. ICU transport took the bed from there with Blake and respiratory. Callahan moved to step inside, but Claire caught his sleeve lightly. Captain. He turned. The upper line is buying us safety, not guaranteeing it. If his pressure changes on transfer, Blake rechecks the clavicular track before anyone floods him with volume. Callahan held her gaze. I will tell them. She let go. Do not tell them. Make them repeat it back. A flicker of something almost human touched his tired face. Not amusement. Respect recognizing its own dialect. I can do that. The elevator doors began to close. Knox lay between tube straps and white sheets with his face turned slightly toward the lights above. He looked less like a warrior now than what all injured men eventually become, under enough machinery, a body being negotiated with. Just before the doors met, his eyes opened one more time and found Claire. No salute, no speech, no dramatic gratitude. Just one look from a man who knew exactly how close he had come to being declared in the past tense. Then the doors closed. The hallway exhaled. The department did not resume normal function all at once. It came back in pieces. A phone rang. Someone at the desk remembered to answer it. A child started crying somewhere near triage. A monitor alarmed from a room that had nothing to do with helicopters or fragments or policy. Hospital life moved forward because it always does, even after the air has been split open in front of it. Claire stood very still for a moment at the elevator bank. The adrenaline leaving her system felt like a tide pulling out through the joints. Her hands were beginning to ache now. Her forearms heavy, her lower back lit with the first faint line of pain from the angles she had held too long. Emily approached slowly as though nearing a fire that had decided not to burn her. Claire. Claire looked at her. Emily's voice broke on the first word and steadied on the second. I have never seen anything like that. Claire reached for the trauma shears still clipped to the pocket Emily had forgotten she was wearing from helping in the bay. She slid them free and looked at the black worn handles for a beat, then handed them back. You kept your head, she said. Emily blinked. I thought I was shaking the whole time. You were. And you kept working anyway. That landed harder than praise. Emily took the shears with both hands. Thank you. Claire nodded once and turned toward the sink alcove near the station. As she washed, the water ran red, then pink, then clear. The copper smell lifted from her skin, slowly reluctant to leave. Staff moved around her in quiet glances and unfinished thoughts. No one ignored her now. No one quite knew how to approach her either. Respect, when it arrives, suddenly often does so in silence first. Behind her, a familiar voice said, Mercer. She shut off the tap and looked up into the reflection of Dr. Owen Blake returning alone from the elevator. He is in ICU, Blake said. Pressure holding for now. Vascular is with him. Claire dried her hands. Good. Blake leaned a shoulder against the wall, fatigue finally showing plainly. You saved him. Claire dropped the paper towel into the bin. I delayed his funeral. Blake accepted the correction. Fair enough. He watched her for a second, then glanced back toward the station where Douglas Vance still stood with the board members, all three of them looking in this direction with very different faces. They want to talk to you. Claire followed his glance and then looked away. Of course they do. Blake's voice lowered. You do not have to be polite. She almost smiled. I am always polite. He let that sit between them because both of them knew politeness and softness were not even remotely the same thing. At the station, Vance finally took a step forward, perhaps because avoiding the moment any longer would look even smaller than he already did. The department noticed. Staff always notice the approach of power, especially when power is walking toward the person it tried to crush and failed. He stopped a few feet away. The board members did not speak. They simply stood there and let the room witness the geometry. Mrs. Mercer Vance said. Claire turned to face him, fully water still clinging in a fine sheen to the backs of her hands. For a second, his practiced voice almost reassembled itself. Then it failed, and what came out sounded human for the first time that day. I may have acted with incomplete understanding. Nobody in earshot blinked. Claire's expression did not change. No. Vance frowned, thrown off script. Excuse me. No, she repeated. You acted with complete understanding of what matters to you. That is not the same thing. The board members looked at him, then at her, and none of them rushed to rescue the conversation. Vance tried again. What happened in that bay was extraordinary. What happened in that bay was predictable, Claire said. A patient arrived dying. A room full of people had to decide whether policy or physiology got the first vote. Blake stayed silent. Emily stood frozen at the desk, pretending to sort labels that had already been sorted. Keller had stopped at the end of the station, not close enough to intrude and not far enough to miss any of it. Even the receptionist had gone very still behind the front counter. Vance glanced at the board members as if searching for a frame that would let him regain altitude. He found none. The silver-haired woman who had stood at the curtain earlier finally spoke. Mr. Vance, perhaps we should continue this in private. Claire answered before he could. There is nothing private about today. Vance's face colored. The board member did not argue. Across the room, a transport orderly pushed a cart past and slowed just enough to catch the words. It did not matter. The department already knew. It would know better by the end of shift. Hospitals write their truest records in memory, not in charts. Callahan approached then from the ICU elevator, having handed off what he could upstairs. His gear was still marked with dust and dried blood. The room reacted to his return with the same involuntary straightening it had shown before. He came to a stop beside Clare and regarded Vance without hostility and without warmth. "My chief is alive," he said. Vance nodded too fast. "I'm glad to hear that." Callahan let the sentence hang there, inadequate and obvious. Then he added, "Your nurse made that possible." Clare did not correct the word "your," not yet. Callahan continued, "You should know something. The first Marine she treated this morning is awake enough to ask who saved him. News moves fast on base. By tonight, half the barracks will know a civilian hospital tried to remove the one person in it who understood what was happening to him." The statement landed with surgical precision. Not shouted, not embellished, just placed exactly where it would do the most damage. Vance's throat moved. Clare looked from the captain to the station and back. She could feel the entire department balancing on the edge of whatever would be said next, every younger nurse and tired physician and exhausted tech, measuring not just the words but the world those words would leave behind. She picked up a fresh towel and dried the last moisture from her wrist. When she spoke, her voice carried without effort. "I need a clean set of scrubs and a current status on bed 6. It took the room half a second to understand what she had done. She had not bowed to administration. She had not performed outrage. She had not accepted apology or begged for recognition. She had turned back toward the work. Emily moved first. "I will get the scrubs." Keller, perhaps eager now to be useful in a more honest key, said, "Bed 6 pressure has been drifting. I can pull the chart." Blake looked at Clare for one long beat, and then a small tired respect crossed his face, deeper than admiration and sturdier than gratitude. "Come find me when you are ready," he said. Clare nodded. "I know where you live." That finally brought the faintest laugh out of him, and because the room so desperately needed one, the tension cracked enough for breath to move through it again. Vance stood where he was no longer the center of anything, and the emergency department, having seen exactly who held under pressure and who did not, began quietly rearranging itself around that fact. The department did not fully recover after that. It resumed function because emergency rooms always do, but function and normal were not the same thing. Normal would have meant voices rising back to their old, careless level monitors blending into the background, residents returning to their little performances of urgency. Instead, the entire floor seemed to move with a new awareness, as if the air itself had been forced through a narrower passage and come out sharper on the other side. Clare stood at the sink a moment longer after Emily hurried off for clean scrubs. The last trace of diluted blood swirled into the drain and vanished. She watched it go because that was easier than watching the faces gathering behind her in the reflection. On the far side of the station, the board members had drawn Douglas Vance into a huddled conversation. He was speaking too quietly for anyone else to hear, but his hands had betrayed him. He kept touching his tie and then stopping as though remembering too late that a man in trouble should not look like he knows he is in trouble. The silver-haired woman from the board did most of the talking now. Another man in a charcoal suit simply watched the department with a look of grim arithmetic, as if he were recalculating the cost of something he had once considered theoretical. Captain Callahan remained beside the desk for several seconds after the others drifted back toward their duties. He did not seem eager to leave, though not because he enjoyed administrative discomfort. Men like him did not linger for spectacle. They lingered when the room still held unfinished responsibilities. Clare dried her hands and looked at him. "How is he?" Callahan answered at once. "Alive, agitated, trying to pull at the oxygen. That feels like him." Clare nodded. "Good." He studied her for a beat. "You should see the other Marine before he gets moved." "Nate." He asked twice already who the nurse was. Claire glanced toward Bay 2, then toward the knot of people near Vance. I am apparently popular. The captain did not smile. You are necessary. There's a difference. That almost drew something out of her, not quite amusement and not quite protest. Before she could answer, Emily returned with a folded set of hospital scrubs and a clear plastic bag. I found your size, Emily said. Locker room 3 is open. Claire took the bag. Thank you. Emily hovered a second. Do you want me to come with you? For a wardrobe change. Emily flushed. That came out wrong. Claire's mouth shifted by the smallest degree. Stay near the desk. The place still believes in emergencies. Emily nodded and clutched the trauma shears a little tighter against her palm, as if she had not yet decided whether they were a gift or a responsibility. Claire turned and headed for the staff locker room. The corridor there was cooler, dimmer, quieter than the trauma bay, and for the first time since the helicopter had landed, she felt the true weight of her own body. Her shoulders had begun to ache from holding angles too long. The inside of her right forearm felt tight where she had braced against the bed rail. Her lower back sent up a low pulse every few steps. Adrenaline had not left politely. It had receded in layers, exposing all the work it had hidden. Inside the locker room, the hum of fluorescent light and the clink of metal locker doors seemed indecently ordinary. Claire shut the door behind her and set the clean scrubs on the bench. For a second, she simply stood there, palms flat against the cool laminate, head bowed. Not praying, not collapsing. Just letting stillness catch up to her. Her own reflection in the narrow mirror over the sink looked older than it had that morning. There was dried blood at the cuff of one sleeve and a faint streak near the collar where she had brushed against the bed. Her hair was still pinned tight, but fatigue had found its way into her face despite the discipline holding everything else in place. She changed quickly. The clean scrubs smelled faintly of detergent and shelf storage. She folded the bloodied set into the plastic bag and tied it closed. Her hands paused over the knot longer than necessary. Not because of the blood. Blood never bothered her. Because the bag looked too much like evidence. When she stepped back into the corridor, the hospital had shifted again. Word had spread beyond the ER now. It had moved upstairs to ICU, to surgery, to radiology, to whichever corners of administration still believed they could shape a day after it had already chosen its own narrative. Nurses she barely knew glanced up as she passed, and then held her gaze a second longer than before. A transport tech near the elevators gave a small nod that carried more sincerity than most speeches. A respiratory therapist from the floor pulled aside to let her pass and said quietly, "Nice work." Claire answered with a nod and kept walking. At bay, 2 Corporal Nate Alvarez was more awake than she expected. The oxygen mask had been replaced with nasal cannula. The chest tube drainage chamber hung steady at the bedside. No sudden jump in output. No ugly surprises in the seal. Good. Nate looked pale and exhausted, but the panicked gray from earlier had left his face. In its place was the expression of a young man trying to understand how close he had come to disappearing before lunch. He looked up when Claire entered. "There you are." His voice was rough, but it had enough air behind it to sound irritated rather than terrified, which in itself was progress. Claire stepped to the bedside and checked the tube out of habit. "I have been around." He watched her hand at the line. "You are the one." "I was one of the people in the room." "That is not what they said." Claire adjusted the blanket near his shoulder. "Who is they?" "Everybody." That brought the faintest warmth to the corner of her eyes. Nate winced and settled back. "They said I was turning blue." "You were." "Feels rude." It was. He gave a weak breath of a laugh, then stared at her more seriously. He was young enough that gratitude sat on him without camouflage. "They told me you got fired." Claire did not answer immediately. She checked the monitor, then the drainage once more, buying a second of silence. "They told me a lot of things too fast," Nate continued. "Most of them sounded stupid." Claire glanced at him. That one was accurate. Nate frowned. "For saving me." for making the kind of decision institutions enjoy after the fact and dislike in real time. He let that sit in his chest for a moment. You still came back. The sentence landed more cleanly than any praise from the board ever could have. Claire straightened. Another man needed air. Nate looked away toward the curtain jaw tightening. My mom keeps saying hospitals are full of heroes. Claire followed his gaze to the corridor beyond. Hospitals are full of people. Some are useful under pressure. When she turned back, Nate was still studying her. He had the raw honesty of somebody too recently pulled from the edge to bother performing maturity. I owe you. Number. He blinked. No, Claire repeated. You owe the next person in your life a little patience when they are scared and not at their best. That would cover it. He stared at her and then nodded once slowly as if committing the sentence to memory because his body was too tired to challenge it. At the doorway, Captain Callahan appeared and tapped the frame with 2 fingers. Mercer. Claire looked up. The board wants you in Conference C. Of course they do. Callahan stepped aside to let a transport nurse pass. Blake is there too. That altered the equation slightly. Claire gave Nate one last look at the tube and nodded at the captain. In a minute. Callahan left without pushing. Nate watched her. You going to tell them no? Claire smoothed the blanket once more. I am going to tell them what is true. Whether they hear no or yes depends on how frightened they are of honesty. Nate looked pleased by that answer in the way young enlisted men often look pleased by bluntness they are not yet old enough to sustain themselves. As Claire stepped into the corridor, Emily caught up with her carrying a clipboard and trying not to look like someone who had run to intercept her. Conference C, Emily said unnecessarily. I know. Emily lowered her voice. Everyone is talking. They usually are. No, I mean everyone. ICU called. Radiology called. One of the surgical nurses came down just to ask if it was true that a helicopter landed for you. Claire kept walking. It landed for a patient. Emily hurried beside her. That is not how anyone is telling it. Claire stopped outside the conference room door and looked at the younger nurse. Emily had gone through something today. It was there, in the steadier set of her shoulders, the absence of apology in her stance. Go back to the desk, Claire said. If room 6 drops pressure while I'm listening to a committee rediscover oxygen, I would take that personally. Emily actually smiled. Yes, ma'am. Claire pushed open the door. Conference C smelled like coffee gone stale in expensive air. A long, polished table sat beneath framed prints of coastal marshes meant to communicate regional dignity. Bottled water waited in neat rows. A legal pad had been set at one place for her along with the printed packet she did not bother touching. Present were Douglas Vance, Dr. Owen Blake, the silver-haired board member, the man in the charcoal suit Linda from Human Resources, and the woman from Risk Management whose expression suggested she would rather review a chemical spill than another hour of this. No one told Claire where to sit. She chose a chair halfway down the table, not at the end, and not across from Vance, but where she could see every face without turning her head much. The clean scrubs and damp hair from a quick wash had erased the blood from her appearance, but not from the room. Everyone still carried it. The silver-haired woman spoke first. Miss Mercer, thank you for coming. Claire folded her hands on the table. You seem determined to keep interrupting my shift for somebody who terminated me. The man in charcoal inhaled softly. Linda looked down at her notes. Owen Blake did not hide the fact that he almost smiled. The board member accepted the strike without flinching. My name is Evelyn Shaw. I chair clinical oversight for the board. We would like to address what happened today and determine a path forward. Douglas Vance opened his mouth. Evelyn lifted one finger without looking at him. He closed it again. That more than anything else in the room told Claire how the afternoon had gone upstairs. Evelyn continued. First, I want the record to reflect that your actions this afternoon directly contributed to the survival of Chief Travis Knox. Dr. Blake has briefed us on the case. Captain Callahan has done the same from his side. Claire said nothing. Evelyn's gaze sharpened. I have also reviewed the incident involving Corporal Alvarez. Based on physician statement and bedside testimony, it appears your judgment in that case also prevented a likely fatal deterioration. Douglas shifted in his chair. Claire turned her head slightly toward him. It appeared that way this morning, too. A flush crawled up the back of his neck. Blake leaned forward and placed both forearms on the table. He looked tired enough to sleep sitting up, but his voice was steady. "I want this plain," he said. She made the right call in both cases. In the first, delay would have killed the patient. In the second, standard intervention may have done the same. Anyone suggesting otherwise is protecting embarrassment, not medicine. No one challenged him. The man in charcoal finally introduced himself. "Thomas Reeve, Finance and Operations Committee." Claire nodded once. The one who counts consequences after other people bleed. That landed hard enough that even Evelyn allowed herself one measured breath before answering for him. "Miss Mercer." Claire shifted her gaze back to Evelyn. "You wanted plain." Thomas Reeve rested his fingertips on the table, perhaps the last remnant of a man accustomed to controlling rooms with numbers. "We are prepared to offer immediate reinstatement with restoration of benefits, removal of the termination from your file, and a revised position within emergency trauma leadership." Claire looked at the water bottle nearest her rather than at him. How generous. Douglas found his voice. "Claire, I understand that trust has been damaged. You understand that your board is now in the room." His jaw tightened. "That is unfair." Claire looked up at him then. "No. Unfair was firing a clinician before lunch and needing her before the parking lot cooled." Silence held. Linda, from Human Resources, stared at her legal pad as if words might rescue her from having to exist in this meeting. The woman from Risk Management shifted once, and then went still, perhaps realizing that every sentence now mattered more than any memo she might later write about it. Evelyn folded her hands. What would you require in order to remain at Atlantic Memorial? It was the first honest question anyone at the table had asked her all day. Claire answered without pause. Administrative control ends at the threshold of immediate life-saving intervention. Douglas bristled at once. "That is not practical." Blake cut in. "It is overdue." Claire continued as though neither had spoken. "Emergency authority, in time, critical trauma gets defined by the medical staff who work the floor. Trauma, surgery, emergency nursing, respiratory, critical care, and flight medicine input if you can secure it. Not legal. Not investor relations, not people who think a clean chart matters more than a living chest." Thomas Reeve spoke carefully now, the way people do after finding out their old tone carries no purchase. Specific policy language can be reviewed. "It will be written," Claire said, "before it is reviewed." Douglas started again. "Hospital governance cannot be dictated by one employee." Claire's eyes moved to him. "Then stop making me carry the burden of being the only adult in the room when a patient crashes." Blake's hand came down lightly on the table. Not in anger, in agreement. "She is right." Evelyn nodded once. What else? Claire had expected resistance. The absence of it made the room feel stranger, not easier. Simulation training every month for high-risk trauma deterioration. Not optional. Residents attending senior nursing respiratory. If they want privileges in this ER, they train under pressure before pressure arrives. Blake said yes. Douglas looked at him. Owen. Blake did not turn. Yes. Claire went on. Standing, rapid intervention protection for nurses and physicians who make evidence-based emergency decisions in clear time, critical decline. You want accountability? Fine. Review the action after the patient is alive or dead. But no one gets punished because paperwork lagged behind physiology. The woman from Risk Management finally spoke. There would need to be criteria. Claire looked at her. Write them with people who have actually heard a chest lose air. The woman held her gaze, then nodded once. Fair. Mass casualty chain of command gets rewritten too, Claire said. Not because of today, because if your building freezes this easily around one helicopter, it will tear itself apart under 10 ambulances. Thomas Reeve scribbled a note for the first time. Douglas sat back, expression thinning as the room slipped farther from him. Evelyn's voice stayed calm. Would you be willing to serve on that rewrite? Claire considered the question. In another mood, in another life, she might have said no simply to make them feel the cost of needing what they had discarded. But revenge had always bored her faster than incompetence did. The floor out there still had residents who froze nurses who doubted their own judgment, patients who would not care one bit about a satisfying refusal if it meant the wrong person was in charge during their worst minute. Yes, she said, if it is not symbolic. It will not be symbolic, Evelyn replied. Claire looked at Douglas. And he stays out of active clinical interference. The table went still again. Douglas laughed once, too quickly, too sharp. I beg your pardon. You heard me. He looked to Evelyn. This is absurd. Evelyn looked back at him with something colder than frustration. Is it? Douglas stared, finally understanding that the room he had once dominated had rearranged itself around a different axis. He tried one last appeal to procedure. I am the Chief Operating Officer. Claire's answer came low and direct. Then operate the building. Leave the dying to the people who can touch them back toward life. No one rescued him this time. Thomas Reeves set down his pen. Douglas. I think that is sensible under the circumstances. Under the circumstances. The phrase was bloodless and corporate, and for that reason devastating. It meant the institution had found a way to agree with Clare without admitting its own soul had been examined in public. That was fine. Institutions rarely repented. They adapted when the cost of denial rose high enough. Evelyn turned back to Clare. One more question. If we agree to all of it, will you stay? Clare let the room sit in silence long enough to feel what had actually been asked. Stay. Not return, not resume, stay. Outside the conference room, a code call blipped over the paging system and was canceled almost immediately. Footsteps crossed the hall. The whole hospital continued at its ordinary work, unaware that within these walls a structure was being bent around what one woman had done with her hands. Claire answered at last. I was the same nurse at 9 this morning. No one moved. The same judgment. The same training. The same hands. If that helicopter had landed somewhere else, none of you would be asking this question. Douglas looked away first. Claire continued. I will stay for the floor. For the patients who do not get to choose whether the right person is standing near the bed when things go bad. I will not stay to decorate a recovery story. Evelyn inclined her head, understood. Blake leaned back in his chair for the first time all meeting. Some of the tension left his face, though not enough to erase the day. Then we have work. Claire rose. Douglas looked up in confusion. That is it. Claire picked up nothing from the table because nothing on it belonged to her. That is all I had to say. Thomas Reeve glanced at the clock. We can draft an interim statement tonight. Claire headed for the door. Do that. Bed 6 still has a pressure problem. Blake stood too. I am coming. Evelyn remained seated, but her voice stopped Claire at the threshold. Miss Mercer. Claire turned. For a moment, the board chair seemed about to say something ceremonious, and thought better of it. What came out instead was smaller and more real. I am sorry we did not know who we had. Claire held her gaze. You knew. You just trusted the wrong metrics. Then she left. The corridor outside felt cleaner than the conference room, though that was probably only because nobody in it was trying to rename guilt as process. Blake caught up with her halfway to the station. You did not have to come in there with a knife, and somehow you still did. Claire kept walking. I was unarmed. That is not what it felt like. She glanced at him. How is Knox? Sedated cursing before the sedatives caught up, which the ICU nurse took as an excellent sign. Vascular thinks the vessel may have been contused and partially tamponated, not fully lacerated. You threaded a very small space. Claire let out a slow breath. Good. Blake watched her profile for a second. You know, they will spend weeks pretending they arrived at these reforms by thoughtful review. That is what buildings do when people inside them save their reputations. He made a sound that might have been agreement. Emily looked about 2 inches taller after that bay. She did fine. She adores you. Claire looked ahead toward the station where Emily was at that very moment, trying to look as though she was not scanning the corridor for Claire every few seconds. She will get over it. Blake smiled fully for the first time that day. Probably not. At the desk, Emily straightened the second Claire came into view. Bed 6 pressure is still theatrical, but his belly is softer, and he finally admitted he gets dizzy every time his wife argues with him. Claire took the chart from her. So, he is still married. Emily laughed, tired and shaky and grateful to be allowed one. The shears still hung at her pocket. Claire noticed. You kept them. Emily touched them instinctively. Only until you asked. Claire held out a hand. Emily froze, then unclipped them and placed them in Claire's palm with almost ceremonial care. The worn black handles fit against Claire's hand like a familiar answer. Do not make me regret returning my own equipment, Claire said. Emily's eyes brightened. Does that mean you are back? Claire clipped the shears to her waistband. It means Bed 6 is not going to assess himself. The answer traveled through the station faster than an announcement could have. A tech at the printer looked up. Keller, coming back from the lab with a tube carrier in one hand, heard enough to slow. Even the receptionist smiled into her headset while pretending to still be fully engaged in her call. Captain Callahan appeared once more at the edge of the department, ready to leave at last. He did not intrude on the station. He waited until Claire looked up. Chief Knox is stable enough for now, he said. Corporal Alvarez asked again if you were real. Claire signed off on a chart and looked back at him. Tell him unfortunately yes. Callahan's expression shifted by a degree the nearest he had come all day to humor. He reached into a pocket and drew out a small challenge coin, dull silver, with a trident worked into one face and a unit crest on the other. He set it quietly on the desk near her hand. From the team, he said. Not for show. Claire looked at the coin, then at him. I am not on your team. Callahan held her gaze. You were today. He gave a brief nod to Blake, another to Emily, and then walked out of the department without waiting for thanks. Claire picked up the coin and turned it once between her fingers before slipping it into her pocket. No speech, no audience. The gesture had been honest. That was enough. Around them, Atlantic Memorial kept moving. A new ambulance report came in over the radio. Lab results printed in a warm paper curl. A father in the waiting room bounced a feverish toddler on his shoulder. Somewhere down the hall, an old television laughed at its own sitcom joke. Claire opened Bed 6 chart. Emily, come with me. We are going to find out whether this man is bleeding anxious or simply tired of his marriage. Emily grabbed a pen and fell into step beside her. How do you tell? Claire pushed through the curtain into the room. By looking at him before the monitor tells you what to believe. That was where the night took her. Not into applause, not into relief. Into another patient, another set of lungs, another pressure, another body, asking for competence and not mythology. The emergency department adjusted around her with the quiet speed of a place that had been reminded what center felt like. Residents lowered their voices and started asking better questions. Nurses, who had once glanced away, now watched her hands and listened. Blake moved through the rooms with the look of a man who had found an ally in a war he was tired of fighting alone. And as the shift deepened and the windows of Atlantic Memorial reflected only darkness back at the parking lot, Claire Mercer stood under the hard white trauma lights exactly where she had belonged all along. Not because a title had restored her to the room, but because the room had finally become honest enough to admit what it needed.